Back in 2018, the second richest man in the world, Bill Gates, warned that we should be preparing for a deadly new disease that will arise and spread around the globe. Gates presented a simulation by the Institute for Disease Modeling that found that a new flu, like the one that killed 50 million people in the 1918 pandemic, would now most likely kill 30 million people within 6 months. 2 years on, and a new coronavirus disease named COVID-19 has emerged. This new disease could be just as dangerous as the 1918 influenza pandemic. It's legitimately scary stuff. So what measures can we all take to survive a possible pandemic before it gets out of control? Let's find out now. Before you decide to seek shelter in an underground bunker, let's take a look at what COVID-19 really is. The outbreak is part of the coronavirus family, a large family of viruses found in both animals and humans that was unknown until it was first reported on December 31st, 2019. This type of virus is zoonotic, meaning it originates in animals and can be transferred to humans. In 2002, the devastating SARS coronavirus was transmitted from civet cats in China before spreading to 37 countries and wiping out around 800 people. Another coronavirus known as MERS was also known to jump from dromedary camels to humans in Saudi Arabia in 2012. The current COVID-19 outbreak has already worryingly surpassed SARS in overall scope and recorded deaths. This time around, the virus likely originated from the South China seafood wholesale market in Wuhan, China, which also sells illegal live animals. Although an official animal source hasn't been identified just yet, bats are suspected to be the initial carriers. The virus was probably then transferred to pangolins, which are valued in Asian food and medicine, before making its way to humans. The World Health Organization officially declared the outbreak as an international health emergency on January 30th, 2020, an action previously taken for swine flu and Ebola. But should we really be worried? The short answer is yes. Over 60,000 people have already been infected globally, including 447 cases in 24 countries outside of China, and the death toll currently stands at over 1,380. These figures show no sign of decline either, as outbreak analysts also predict that the number of reported cases will double every 5 to 7 days, while one disease transmission model published in the journal Annals of Internal Medicine suggested more than 300,000 people could be infected by February 24th. To get an understanding of COVID-19's deadly potential, let's examine its mortality rate, which can help us speculate how much of the world's population could actually lose their lives to the virus. The case fatality rate refers to the amount of people killed by the virus divided by the overall number of infected cases. Seasonal influenza, better known as the common flu, has a case fatality rate of 0.1%. and is thought to cause about 400,000 deaths globally each year. Meanwhile, the 2002 SARS outbreak had a mortality rate 100 times higher than flu at 10%, killing 9.6% of those infected. Currently, the mortality rate for COVID-19 is nearly 3%, which for some perspective is on par with the 1918 Spanish influenza epidemic that wiped out 50 million people, about 3 to 6% of the Earth's population at the time. Thanks to advancements in medicine since 1918, it's unlikely we'll experience similar population-culling pandemic nowadays, but the unprecedented spread of COVID-19 is no less concerning. The deadliest day of the outbreak so far was the 12th of February, when a grim landmark of 242 deaths and 14,840 infections were reported in the Chinese province of Hubei, which now comprises 80% of all Chinese cases. However, this sudden spike should be taken with a grain of salt after it was reported that a new method was being used to diagnose infected patients. People presenting early symptoms as well as a CT scan showing a chest infection are now being counted in the definitely infected column without undergoing definitive testing. This sudden intake of suspected cases has thrown trend mapping efforts into chaos, with some suggesting that China's official numbers could now be largely overstated. At the same time, China was accused of delaying informing the rest of the world about the severity of the deadly disease in the days before this broader diagnostic change, meaning the true scale of the epidemic is dangerously elusive. If you're not planning on catching the virus, you should probably know what the symptoms are first. The tricky thing about diagnosing someone without a proper test is that coronavirus presents itself in similar ways to a typical bout of flu. Initial signs of infection include a fever and a dry cough, followed by a shortness of breath. In extreme cases, this leads to severe acute respiratory syndrome, kidney failure, pneumonia, and death. What's even more worrying is that experts believe COVID-19 has a considerably long incubation period, which is the amount of time between someone becoming infected and actually showing symptoms. This period is estimated to be anywhere up to a whopping 12 days compared to the 2 days it takes someone to show clinical signs of influenza. We can't be certain just yet, but this means someone could be infectious before they even know they have the virus themselves. Now you know what to look out for. Let's examine how COVID-19 spreads and why it's happening so fast. This new coronavirus is respiratory, so the primary method of transmission is through coughing and sneezing. Although respiratory viruses can also be transmitted through tiny dry particles known as aerosols, which stay suspended in the air for 10 minutes, this isn't thought to be the primary mechanism for COVID-19. Instead, small droplets of bodily fluids like saliva and mucus are dispersed up to 7 feet into the air through coughing and sneezing and can be either directly inhaled or fall onto surfaces which others come into contact with, like door handles and train seats. Expert analysts believe that each infected person is currently passing the virus on to 2 to 3 other people, and anything higher than a 1-to-1 person ratio means that the virus is self-sustaining and is unlikely to just burn out on its own. There is no evidence showing how long the virus can survive on surfaces, but preliminary information suggests it could be anywhere between 3 to 12 hours. Before you go quarantining your pets, you should probably know that companion animals like cats and dogs can't give you coronavirus. So there's one positive. The good news is that in most cases, people infected with COVID-19 will recover in a few weeks with rest and recuperation, while some patients may need hospitalizing for breathing support. Of course, anyone who has traveled from China since the outbreak is most exposed and should seek a medical opinion followed by a 2-week quarantine period if necessary. There are a few exceptions to this rule though. Besides travelers, research shows that the elderly population and those with pre-existing health conditions are most at risk when it comes to surviving COVID-19. According to a recent report from China's National Health Commission, about 80% of those who died from the virus in China were over the age of 60, while 75% already had weakened immune systems due to conditions like diabetes and heart disease. Another study from the Lancet Medical Journal calculated that the median age of infected patients was roughly 55. While the majority of all reported cases have occurred in people over the age of 40. At the moment, the virus seems to be sparing one group in society: children. There have been very few cases identified in young people. A similar case happened with SARS, which had a fatality rate of less than 1% for people younger than 24. And that's all the basics covered, but I'm sure you're left with one burning question. How can I survive COVID-19? China is already taking drastic measures to stem the outbreak by putting major cities, including the entire province of Hubei, into total lockdown. This mass quarantine has already affected 60 million people, and in some high-rise buildings, elevators have even been switched off to encourage residents to stay indoors. Shutting down swaths of the world's second biggest economy hasn't been easy, and has caused further problems with worker shortages, transport disruption, and lack of medical aid. Considering a global lockdown would be nigh on impossible, not to mention the devastating knock-on effect it would have on national economies, it's mostly down to us to stay vigilant when it comes to preventing the further spread of COVID-19. Here's the bad news. There is no vaccine for the virus. Because this is a totally new strain of coronavirus, doctors still don't know much about how it works, which also means it's impossible to be immune because no one ever caught it before December 2019. The World Health Organization is already racing to develop 4 possible medicines to treat the virus quickly. And although initial trials could begin within a couple of months, it's unlikely a vaccine could be mass distributed within the best part of a year. Because COVID-19 is viral rather than bacterial, antibiotics also won't work as preventative measures, and doctors are yet to discover if any viral remedies could be effective. In the meantime, there are a few things you can do to better your chances of dodging COVID-19 altogether. It may seem obvious, but standard hygiene is key. Washing your hands regularly and coughing or sneezing into a clean tissue or flexed elbow are the primary measures recommended by the World Health Organization. If possible, maintaining good social distancing in public spaces is also important. Some guidelines define coronavirus exposure as being within a 6-foot radius of someone who is coughing or sneezing for just 10 minutes or longer. So try to place an imaginary safe zone around yourself if possible. Simple disinfectants can also kill the virus easily on surfaces, so cleaning your home or workplace regularly and carrying alcohol-based hand sanitizer is a good idea. You may have seen people wearing face masks in major cities, but there's little evidence to suggest that these can actually lower your chances of getting the virus, because pesky droplets could still pass through the loose and permeable material. Masks are only recommended if you're showing symptoms yourself, or if you're caring for someone who might be. Special care should also be taken when preparing food like meat and eggs, while raw or undercooked animal products should be avoided. With the COVID-19 outbreak now in full swing, boarding a plane is probably the last thing on your to-do list. If you do need to travel internationally, though, you should probably get clued up on how the virus spreads from passenger to passenger. The World Health Organization defines contact with an infected person as being seated within 2 rows of one another, but this doesn't account for people moving about. In fact, during the 2003 SARS coronavirus outbreak, a passenger aboard a flight from Hong Kong to Beijing infected people well outside this 2-row boundary. One study by the Fly Healthy research team monitored people's movements on 10 transcontinental flights of 3.5 to 5 hours and found that 38% left their seats, 24% got up more than once, and another 38% stayed seated. These seated passengers generally sat in window seats. In fact, only 43% of window-seated passengers moved compared to 80% aisle-seated, so perhaps picking a window view and staying put is your safest option. As the outbreak grows, it's been reported that there could be one saving grace in all this chaos: summer. That's right, President Trump announced on the 10th of February that the heat is basically going to kill the virus. He's not the only one, as the UK's Health Secretary Matt Hancock also claimed that the virus would be less transmissible in the summer months. As far as actual science is concerned, however, these are some bold claims. According to virologist Trudy Lang, the truth is that until summer comes, there's no way of knowing how the virus is really going to react. What's more, David Heyman from the London School of Hygiene and Tropical Medicine has rightly pointed out that the MERS coronavirus spread in Saudi Arabia in August, which was by no means cold. So if summer isn't going to kill off COVID-19, how is this all going to end? Top Chinese epidemiologist Dr. Zhong Nashang proposed on the 11th of February that the epidemic is expected to peak in China this month before subsiding. But this seems to be an overly optimistic statement. The World Health Organization has already explained that it's still way too early to predict the end of the epidemic, while others, like infectious disease expert Amesh Adalja, have even taken a more extreme perspective by declaring the outbreak a mild pandemic. It seems like there are 3 possible outcomes. Firstly, the coronavirus is halted by public health interventions, like the 2003 SARS outbreak. This doesn't seem likely, though, as COVID-19 is far more contagious, and the real possibility that people are infectious before showing symptoms means the virus is harder to track and contain. Secondly, drug companies could manufacture a vaccine that is successful in definitively controlling the virus, but this is a particularly arduous and time-consuming process. The most likely outcome is that COVID-19 will become a permanent health fixture that fluctuates with the seasons, much like flu. In this instance, the virus will continue to circulate, but could become milder in warmer months. As the virus would then be considered endemic, meaning permanently present, we might require a preventative measure like the flu jab to fight it off each year. No one can be sure what's going to happen next, and your current chances of catching COVID-19 outside of Hubei or even mainland China are still considerably low, according to experts. But hey, at least you're prepared now.